Coronavirus is far from over. Some countries are still dealing with large epidemics, but even those currently controlling the virus fear the second wave. The second phase of Spanish flu a century ago was deadlier than the first one. So is the second wave inevitable, and how bad could it be? What could trigger a second wave? Well, lockdowns have caused massive disruption around the world, impacting the economy, people's health, education and job prospects. But they have controlled the virus. Dr. Kuharshek says that the ultimate puzzle is how to maintain control while minimizing daily disruption. Nobody is 100% sure how far we can go, and that is why measures are being lifted in stages and new ways to contain virus are being introduced, such as social distancing, face masks and contact tracing. He adds that in the UK and the neighboring countries, flare-ups could happen quite quickly if measures are lifted beyond the point transmission is controlled. This has already started in Germany, where 650 people were tested positive after an outbreak at an abattoir. South Korea, which is widely praised for its handling of coronavirus, has had to reimpose some restrictions due to the fear that the country is losing control over the virus resurgence in a few clusters. The mayor stated that the complacency of citizens in social distancing, increasing public transportation usage is the influencing factor of resurgence. Fearing a second COVID-19 wave, Europe aims to train an army of medics. Europeans are enjoying the gradual easing of coronavirus lockdown measures, but in hospitals, they're already preparing for the next wave of infections. Some intensive care specialists are trying to hire more permanent staff. Others want to create a reservist army of medical professionals ready to be deployed wherever needed to work in wards with seriously ill patients. European countries have been giving medics crash course in how to deal with COVID-19 patients and are now looking at ways to retrain staff to avoid shortage of key workers if there is a second wave of the novel coronavirus. It is not a major problem if clusters can be identified rapidly, local lockdowns implemented and spread of the virus is contained. Otherwise, the complacent attitude will lead to a second wave. Let's explore further in part 2.